Hello, beautiful people. Welcome to JAPADA. Now, life has a way of teaching us things in a roundabout manner. 1 minute, we think the most important thing is our career, making money and paying bills. Then suddenly, a higher purpose comes. Some revelation that makes us realize that there's more to existence. There's impact, there's influence, there's legacy. And the only thing that can help us attain that, above all, is good health. Today's guest defines that. Find out her full story, unfiltered and unfettered, right here on Nigeria's favorite show, JAPADA. Welcome back to JAPADA. She is the CEO of IYEWO, a primary care startup in Lagos, and concurrently the executive director for Amal Outreach, a non-profit that facilitates access to healthcare and underserved community development. She is Dr. Folake Kofo-Idowu. Welcome, Dr. Folake.
Thank you. Thank you for having me.
Thank you so much for honoring our invitation.
Welcome.
On a personal note, I have to say I have so much respect and admiration for you. First of all, just because you're a doctor. I honestly think that doctors are at the top of the food chain when it comes to human existence. I think that what you do is almost heavenly.
Well, in a way, a little bit, because I think we meet people at times where they are very vulnerable and when they don't either have an understanding or a control over what is happening, and it's something that literally could. So having someone who can like take charge and put things back in place, is amazing.
Thank you so much for everything that you do.
Thank you.
Honestly. Now let's get into your story. Can you give us a brief background into you personally? So your family background, your educational background, and
So I was born in Lagos, born and raised in Lagos. You know, all my education, I would say primary, secondary, did that in Lagos. I graduated medical school from Lagos State University, College of Medicine. I was one of the early sets, third set actually, that was enrolled in the medical school, and then worked a little bit in and around Lagos. And while in medical school, I had the thought of wanting to train abroad. Just because I initially wanted to be a surgeon, heart surgeon. Shout out to my mentor. And I initially wanted to be a heart surgeon. And for me at that time, I looked around. First of all, we didn't have enough cardiac residencies in Nigeria. And what was coming up, the structure that they had wasn't satisfactory to me. I was like, I want to be good. I want to be really good. And I didn't think that what they had would give me the opportunity. So I'm like, where in the world can I go to just be great at being a heart surgeon? And the US was one of the places I felt I could go. And I went there. But as life would have it, you know, the course changed and I did internal medicine. And currently I'm an infectious diseases specialist. So still do sometimes work with heart surgeons if things go just bring the infections down and try to sort things out.
Which is equally as important.
Yes.
I mean, when I think about things like Ebola and COVID, I'm even more thankful for people like you, right?
Yes.
So what was it about, clearly you JAPAD in the first place, in pursuit of a better education, you know, you wanted to be the best in your field. What did you find when you moved to the United States that, or what did you experience that caused you to switch paths from being a cardiac surgeon to being an internist?
Yes.
Yeah.
So the switch to being surgeon, I think it was more personal.
Okay.
Yeah, you know, I'm a person of faith. And I would initially, I would pray because you know the steps that are laid out to achieve something. And I was like, it's pretty intense. And I would pray about it, but I would still feel confused. And I'm like, okay. And then we would just keep going. And until something came up and I prayed about it and I made the switch and I was fine with my decision and I'm glad. But, in getting into residency and I saw how they were living, I'm like, oh, thank God I didn't do that because medical training is very intense, but surgical training is several notches higher. You're seeing people leave the hospital at late and odd hours and they're back in the hospital before the crack of dawn and you're like, how do you have a life? And so many things like that they have to deal with, but they pull through because they're passionate about what they want to do and they achieve it and do great things. So it was more of a personal decision that made me veer, but I'm still grateful. I'm very, very grateful for that because it's brought me to where I am right now.
Where you are, exactly. So clearly balance means something to you, right? A balanced life. So you completed your residency in the US. And I mean, right now, I feel like I'm I'm almost fangirling. So one of my favorite things to watch are the medical shows.
Okay.
And I've never had a conversation with a doctor that has actually trained in, so I mean, I'm thinking Grey's Anatomy, Chicago Med, all the medical shows that I love. Is it as depicted on TV? The pace in the hospitals, do you watch medical shows?
Yes, I do.
Yeah.
I love Grey's Anatomy.
Right?
Yes.
So was your experience anything like Grey's?
My ICU experience was close, but it's not always as intense because keep in mind it's a show, so they have to pack
amp up the
all
drama.
They have to pack all that. They show you one patient in a room that's crashing, but there's like 10 others that are kind of stable and they're not showing you, and somebody's taking care of those ones. So it's not always like that. And they're showing you maybe concentrated of maybe 5-10% of what actually happens.
Goes on. Okay, that's
but
fair.
Yeah,
so it's not always as doom and gloom as they present it to be.
No.
Okay, that's good to know. It's reassuring. So when you moved to the US in pursuit of further education, at the time you were leaving Nigeria, was it already clear to you that once you got to the United States, you were going to finish your residency and come back home immediately? What was that journey like?
So interestingly, I don't think I had a thought of how my return would be.
Okay.
But I knew that when I was leaving, what I was sure of was I'm going to get education. And several people that I had the conversation with, I'm like, I'm just coming here to train to be a better doctor. But interestingly, thinking about it right now, I never actually had thoughts around how I would come back. And, as time went on, yes, in a way, I maybe did see myself a little bit like just living there in perpetuity, but I knew that I would always have something to do. And when I thought about the things I wanted to do, they were extensive enough that you would know that, you're in the US, but it's kind of like a lot of what you're doing, maybe the impactful community-wise or just things like that, would be out of the country and you're just working in the US, like doing your livelihood. I see. So at what point did the thought first cross your mind to come back home? That I would say, I've always had it. That's the interesting. I've always had it. So it's not at this point I had a light bulb moment. I remember when I was in medical school, I'd always wanted to do community work. And I had thought about how people did community work. And when I graduated, I worked, volunteered in some missions and stuff. I saw how people went about and I felt it was still very inadequate. Because imagine, somebody puts up nice, elaborate thing, go into some remote place or wherever it is, they set up, they're looking at, even if they looked at as extensive as possible, it was still for a short while. What happens to those people afterwards? Or sometimes they come and they're looking at very specific things. And there's only so much you can do on a mission, right? You come on a mission, even if you diagnose somebody of a breast lump or a hernia that needs surgery, there has to be something afterwards to follow up to make sure. And that happens. Or you're coming there, you're seeing people for hypertension, for malnutrition. someone in that community is having something that you're not checking for. So for me, it was like, there needs to be a 360-degree thing. And when I started out, whatever it is I was coming to do in Nigeria, I started from a nonprofit angle, but you quickly realize that's not sustainable to get the amount of impact and change that I envisioned. So that, for me, was it. So I never really had like a specific time, but to say, oh, I'm coming back because I want to come and give back. But what I had was like, I'm tired of living here. And I'm ready for a change of scenery. More like, so that was, I think that was probably what I had, which is I'm ready for a change of scenery. And that would be maybe like 2-3 years ago, about, somewhere in the last 5 years, I had the thought where I'm just like, and I told one of my friends, I said, I need to be taken care of. And I cannot take care of myself by myself to the level that I need to be taken care of. So I need help. And I can't get that help here. So
and I mean,
I'm just gonna move
probably
over.
Waiting for you at home.
Yes, I'm just gonna take myself to where I can get the help, and then we'll be fine.
I love that. I like what you said about, I mean, I'm eager to get into your story and figure out your experience in terms of your expectations when you were moving back and the reality that you faced. And we'll get to that very shortly. But right now, I want us to play a game.
Okay.
Yes. This one is called Niger Slanger.
Oh, okay.
So it's basically a list of Nigerian slangs that I have that I want you to tell me the meaning of. Pretty easy.
Okay, that's
right? Okay. The first one is longer throats.
Someone that is kind of greedy, probably likes to eat.
Yes, exactly. What about kolobi?
Oh, wait, okay. To take or convert something.
Yeah. Nice. Mineral.
That's soda.
Yeah.
Coke and stuff.
Para.
Get angry, lose your temper.
Aproko.
That's beboru. I think, is it beboru? Yeah, someone that just talks a lot and doesn't mind their business.
Yes. What about a JJC?
Jolly Just Come. That's new in town. That's, I think it's maybe a street way of saying I just got back.
I just got back.
Yeah, so you just new, you don't know anything.
Yeah.
Fresh meat.
Anybody that JAPADAs freshly is a JJC. Legady's bends.
Your legs. They take you everywhere, very reliable.
They take you everywhere. Fashi.
To not bother about something, just discard something, like, don't worry about it. Fashiam.
Yeah. And efiko.
A bookworm.
Wow. Come on, Dr. Folake. Would you describe yourself as an efiko?
No.
No?
I'm smart, but I'm smart, but I learn differently, and I don't learn by sitting down and reading like most people would see. So yeah.
So no.
I'm not an ethical.
I like that. It's giving balance, and I particularly love balance.
Yeah.
Fantastic. I'm still here with Dr. Folake, and we are discussing everything from her journey in the medical field to her pescatarian interests. When we come back, our conversation continues right here on JAPADA, so don't go anywhere. Welcome back. This is still JAPADA, and I'm still here with Dr. Folake Kofo-Idowu, and we're having a good time. Yes. Now, let's bring it back home.
Okay.
You were done with the US, you said the one thing that you knew is that you were done with that environment. It was time for a new environment, and luckily, the new environment happened to be home.
Yes.
You got back here and you set up IYEWO Clinic and Amal Outreach.
Yes.
Let's talk about those first few months after you moved back. What was that like? And how quickly were you able to set up these two companies?
So, interestingly, I had started doing these things even while I was working. I set up Amal Outreach while I was doing my residency.
Okay.
we did a little outreach thing in like 2016, and then I was like, yeah, if I'm gonna be asking people to donate, you need to formalize it. So I registered it, blah, blah, blah. And then we did our like formal outreach in 2020.
Okay.
So the nonprofit was founded in 2020. And I was still in the US then, back and forth, just doing stuff. I hired staff and we were doing what we're doing. So in Amal, we did a hypertension and diabetes. And again, when I talked about like what happens afterwards, I was like, okay, so if we do a hypertension and diabetes screening, the positive people, what happens? There's a reason, a lot of them had been previously diagnosed.
Yeah.
What happens after? So we set up a community monitoring program and hired local youths, just hired them, trained them on how to check blood pressure, had a supervisor. So they would go to people's shops and homes, because it was in Lagos Island, to check their blood pressure, check their blood sugars, and we would, oh, this is high, this is what you should do, okay, I'm going to come back, use your medicine, or you need to go see your doctor. We had people who sometimes would go with clients to General Hospital because she would come back and be like, yeah, the doctor said, I can't remember. They said I should buy, I can't find the paper. So sometimes they would go with them to help them understand doctor's instructions so they can get it done at home. And then as we continue that, I realized for sustainability and just to deepen the impact, nonprofit angle was not going to cut it for what I wanted, for what needed to happen. And that was having a good primary care structure. And so IYEWO started as a program under Amal Outreach, and we piloted a little bit. Once it made sense, then we brought it out as a standalone company. And so all of this was still me being in and out of the US. And good thing was, after I graduated, worked a little bit full-time, I transitioned into what we call locums, so that it's kind of like travel doctor, travel nursing, and I would batch my work up into like a 3-4 week period, and I would have like a 3-4, sometimes 6-week break. I could pick my hours, and that gave me the opportunity to travel or do whatever, and I was doing that. So like last year, 2024, I was in and out of Nigeria several times. By July, I was in and out 4 times. Yes.
Wow.
And then, again, as things were going on, you just keep coming to the realizing, I'm like, this thing needs me. There's a lot of things that you need to do, and you can't, there's only so much meetings you can pack into a 4-week period. Everything was always rushed, and I knew that wasn't sustainable to help us grow. So I just kept thinking, what would be great is if I had an avenue that I could just go do this thing. But again, I was funding it, I'm leaving, I have a life, you have to keep that up. And so you just stick with what you know. But I think because I had it in the back of my mind, and it's something I tell my peeps, it's like, just pen down your dream. If everything was perfect, no hindrances, no buts, just write it down. Know the ideal thing you want, because you never know. You could get the opportunity, and once it's there, you just bring out the blueprint, like, oh yeah, this is what I need to do. And you go, you're not trying to build it. And so because I had that thought in my mind, I think once the opportunity came up, I was just like,
yeah. Would you say that you faced any fears when you started to pursue this dream of yours even more rigorously, especially when you realized that it wouldn't cut it as a not-for-profit anymore, where it became clear that you kind of had to pivot and change the way you do things a little bit with IYEWO Clinic? Yeah. What fears did you face in that moment? Because that's a pretty big change, right?
I think the fear came when people were not responding as I thought. Again, you're rose tints, glasses, and you're naive, like, oh yeah, it makes sense, they would. And then you're there and they're like, yeah, I have to choose between paying you for some healthcare that you're saying that I need versus putting money for my kids, for school, for food, or stocking my wares. And it's not like I didn't know that, but again, you're not in their shoes, you can only guess. And the economy is changing also. It puts more pressure and more pinch on their purses. So you're looking and you're in this space where it's not moving as fast or as quick or even as well as you had hoped. And that's where I just was like, okay, is this thing? But I'm like, everybody says it's a good idea. So what is going on? And I went through a period where I had to like remind myself, I am not the one failing. I'm doing something that's failing. I need to figure it out, but I'm not the failure. The thing is not working out. And it's probably either it's not a good idea, or where the strategy or the implementation, and you just need to figure it out. If outsiders think it's a good idea and you know it's a good idea, and the beneficiaries know it's a good idea in a way, I mean, they like the benefits, they just don't want to pay. So it's like, we just need to figure out a way that it's going to work. So I think that's where the fears really came, like, is this thing really going to, because it might be a great idea. I remember someone said they started, or they were one of the early people that started paying with a card in Nigeria, and they were years ahead of their time, and their own company failed. But look at us today. Yeah. Right? So, but I'm a person of faith, and I was just like, if it doesn't work, I have done my bit. I would do my best to do my best. Yeah. And if it doesn't work, I hope somebody else takes the lesson from it and it's able to make it work for the people that need it. But it is what it is. And so I just took it like that. Like, I'm gonna do my best, and if it doesn't work out, that's fine. But yes, there's still a fear of it doesn't work out. But I'm like, you know what?
Yeah,
that's life.
What's the worst, right?
Yeah, that's the worst that will happen. And you just get over it. Like, okay, it could fail. All right, but let's try.
So would you say that your belief, your shared belief in the idea, because you said that, I mean, you knew it was a good idea. Yeah. So would you say that your belief in that idea and just knowing that it was a good idea is what kept you here? Because you could have decided to pack it all up, right? And head back to the US. You had a career, and it was familiar terrain at the time. What kept you here? I just want to be sure that I'm assuming correctly. What kept you here, still pursuing, still trying to make sure IYEWO Clinic worked? What was that thing?
It's not so much that. It is, I mean, a big part of it is that I believe in the thing that I'm building. But I think a bigger part of it is that people need what they need. And so I was like, I don't want to make it profound, but people need this thing. They need health security. We as a people, we need a shift, we need a change, and we deserve it. In a way, sometimes you look at it like, we don't deserve it because we be doing anyhow, but we also deserve, because we're human, and having health security is just, it's a right as a human being, and people deserve to know that they deserve to be healthy. Yeah. Right? And so for me, it's just like, it was more about the beneficiary and what is needed to be done for people to see themselves worthy of somebody taking the time out to take care of you. Whether you're paying them or not, whether it's a government hospital or not, it's that I deserve as a human being for somebody somewhere to be thinking about my health, which in a way at baseline, that's the job of the government, right? It is what it is, but somebody should be thinking about their health. Somebody should be thinking about their welfare and their well-being, right? And if it's not happening, then that's where private citizens come in. How do we close that gap? Yeah. And I think that was another big part. Like, something needs to be done. And I say a phrase, when you know better, you do better. So I knew better. And I'm just like, yeah, it just has to change. Yeah.
So in your experience, and I imagine that the experience is wide and varied, considering what you do, is there a particular moment or story that you can share? Or I mean, something that you witnessed that kind of reaffirmed to you, this is why I came home. This is why I moved back.
So we have a client who, honestly, I never even took time to find out exactly, because again, patient confidentiality. I am not her doctor. Technically for that business, I'm a doctor, but I'm the administrator, right? But every time they talk to her, she says, IYEWO saved my life. She just had all these chronic symptoms and they took care of her, and she just said, IYEWO saved my life. Literally, that's what she says. And it's touching. There's another woman, I think we recorded her testimonial, and she was like, oh, VP, something that her blood pressure is high, and permit me to say in Yoruba, she said that, that, when you guys started taking care of me, my blood pressure came down, I'm sleeping better, my headaches are gone, and it's things like that, because it's not like they can't get it anywhere else, but they weren't getting it. And we're there to fill that gap. And so, yeah, it's just, you just think about, like, I could be doing a lot of other things. There are times where it's frustrating, or I'm talking to my staff and I'm like, you guys, this is actually a negative on my account. This is my personal fund, my blood, sweat, and tears, right? All of this, whatever work you're doing is not generating your salary yet. And so you sometimes you think about it, is it worth it? But yeah, it is worth it. And I think because maybe my focus is not so much, I want to create a business and make millions of dollars, even though I do. That's not why I'm doing it, but I want to make the money. But it's really because of the impact and the change that is necessary. And that's, what kept me awake and kept me thinking and nudging, like, you're doing this job, you're outside the country. Something just flashed my head. I remember I would talk to my friends and we're trying to figure out, and someone was asking me one day, like, how are you sure? I'm like, because I'm sitting in a computer in a country that has power, you have electricity, you have a good road, you're not worried about you're working, you're paying your bills, life is fine, nobody's shouting on your head, but I'm sitting in front of a computer and there are days I'm just crying. I'm just in tears. And I'm telling myself in my head, Folake, so this is what you're using your life to do. Right? And it's not like I wasn't making a difference. I had patients who loved me. I was leaving a job and I had patients who were crying, who were hugging me and praying and all of that. I get, glowing reviews from my patients, but it's just when you're made for more. And I tell people that there's so many other people who can solve problems in the US. There's a lot of us who can solve problems in Nigeria. How many of us are choosing to? How many of us are equipped to, and how many of us are willing to? The number withers down. And so when you find yourself anywhere in that cater, I think you should just take it seriously. So people who are willing to might not be many, but people who are interested in could support those of us who are willing to, right? And so it's just trying to balance things, but yeah.
I love that. I love that perspective so much. So would I be right in saying no regrets?
No.
No regrets on moving back?
No regrets.
No regrets on the tunnel vision and seeing it through?
No regrets.
Absolutely. So if you could go back to 4 or 5 years ago or 6 years ago, before you moved back, you would make the same decision?
Quicker.
Quicker.
Faster, yes.
Faster. Love that. She would make the same decision quicker, faster, and achieve incredible results. I'm having the best time and best conversation with Dr. Folake, and I really hope you are too. Don't go anywhere though, because when we come back from this short break, the conversation continues right here on JAPADA.
Hello, I am Dr. Folake Kofo-Idowu, the founder of IYEWO. Welcome to IYEWO Clinic.
My name is Anulua Oyelude. I'm a medical doctor and I work with IYEWO. IYEWO is a brand that focuses on preventive care for the informal sector. So by the informal sector, I mean market women, usually people that are not able to afford the healthcare that you usually have, and that's bringing them to a focus where they're able to do so. Another thing is that we also help them to save for healthcare when they're able to do that. So we are bringing them closer to health insurance. We also help them to do regular checkups at their points. We're bringing health to those women, right, which makes it more convenient for them and gives them the allowance to be able to afford and access care quickly. Regarding challenges working with the demographics, seeing that they are from the informal sector, one is you would expect people that are also older. So one will have language barriers once in a while. especially the fluency in language. And I think that helps because the people that work here, the community health care workers, they are focused to know the language of the land to help to break that barrier. So one is language barrier, another is understanding their behavior, and then being patient. I've been working with Dr. Kofo-Folake for about 7 months now, and it has been a great experience for me. She has been very receptive to ideas, to feedback. Her ability and her acceptance of growth is very attractive. And I think that has really helped me to also see the great purpose that comes with this line of work. It has been a very collaborative work here with the other staff as well. And I think that it's a very wonderful work that is going places.
Welcome back to JAPADA. I've still got here with me Dr. Folake Kofo-Idowu. So there's something we like to do on this show, and it's actually a personal favorite of mine.
Okay.
It's called the JAPADA checklist. Now, there's so many people like you, doctors and otherwise, that are probably flirting with the idea of returning home. If you were to have a conversation with some of those people, what would you advise them to consider? What would you advise them to bring back with them? What would you advise them to leave behind? I mean, what are some of the things that you would include on your JAPADA checklist?
Community would be number one. There's a research, there's a research that looked at people who, and it was abroad, people who moved to a new place for work and just how they fared. And the study showed that people who had someone where they were moving to, either a family or a friend, did much better than someone who moved to a city where they knew nobody and they had no friends. So community is very big, and we're all now more aware and more keen into our mental health. So it helps because when you have someone, and Lagos especially, when you're abroad, you'd be like, you're in your house all day, you'd be like, well, everybody's going through the same thing, right? But when you're in Lagos and you're on social media, you're like, it's popping here, it's popping there, and I'm at home, right? So that also helps. And community also would give you information because you would have people who will clock you on things that, you shouldn't be giving your car to that kind of person. Don't use that kind of mechanic. Don't buy fuel here. Don't eat in this place. So it becomes easy for you to get information, not just invites. And people who are moving back, obviously, don't, depending on what you want to do, don't be too cowboyish about it. Okay. Give yourself a soft landing as much as you can. You're coming from a place that has electricity, so you want to get accommodation. Get accommodation in a place that has stabilized their electricity and supplemented in one way or the other. Security, so at least you're not fretting too much and you can focus on whatever it is. And one advice that I got and that I took, and I think is good, is don't rush to buy, especially like a home or even a car. When I moved back, I did a car rental for a short bit. It was costly and I quickly switched, but again, I was able to quickly switch to buying because I've been in and out of Nigeria. I mean, like for the past 10 years, every year or every 2 years, I think it was only COVID period, I didn't come for an extended period. So I'm not too detached that I don't know anything. Okay. But if you, depending on how much people you know or how much knowledge you know of the resources and the plugs, then don't rush to buy assets because there's a lot of things that you might buy it and just not like it. And then what are you going to do? Take it to the courts or, how are you going to resolve it? So that, I think those are big things. Having community, getting proper information, not rushing to cushion your life, soften it for yourself. It doesn't have to be hard, honestly.
It doesn't have to be hard.
It doesn't have to be hard. And try and, save up some of those dollars because it will help you. The exchange rate makes it a little easier. A little over there goes a long way here. So we at least were able to maybe pay for a bit more extra comfort or something to make yourself comfortable. But as much as possible, make yourself comfortable because I read a quote on social media and it says, make room for for good days and for good things, because the bad things will take. And Lagos is a hustle, right? The hustle is just there. And it's going to take from you what it's going to take from you. So schedule good days, schedule rest days, put yourself in a comfortable environment. You don't have to be hopping Uber all the time. Because Uber in Nigeria, looking at the box Suzuki versus Uber in Dubai, regular Uber in Dubai that is driving you in a Mercedes-Benz, or in the US where you're getting a good car. So, yeah. I would say that.
I love that. And I love that you said schedule the good days. I really love that. Be intentional about your soft life.
Yes.
I mean, you've heard from Dr. Folake. Make sure you save your money. Make sure you work on your community so you have some guidance. And schedule those good days. And who knows, your JAPADA journey just might be a really smooth sailing one. And there's a burning question in my mind. Because you set up your clinic in a market, and not just any market, Akpombo.
Yeah.
Wow. I mean, you moved back, and you said earlier, you talked about, sitting in a place where systems work, so there's electricity, things work. Yeah. One would think that even if you decided to move back home, you would want to play primarily in a space that is closest to where you're coming from. But you decided to go deep into the marketplace. Why that?
Couple of things, or a few things. One, unfortunately, a pattern I've noticed about myself is I tend to pick the hard problems and the hard way to do them. I keep learning lessons, but that. Two is, again, what spurred me to this line of where I'm directing my, professional career and work and stuff also was born out of a personal experience, right? My mom traded in Okeari markets, right? And I watched her through her own health struggles and things that she went through when I was a child, and I didn't understand a lot of things. As a doctor, you're putting them together and it's making sense. And so I'm like, we were able to help my mom in the way that we did and, cushion her health care and her life, because I'm a doctor and her kids are educated and stuff. But there are so many other women, so many other people who do not have doctors or health workers or children who are college or university educated, who are aware enough. And who would be that person for them? Who would bring something that would turn their life around? Keep in mind again, and when I'm talking about it, most of these people are daily earners. Some of them are small. Those who are selling big stuff like lace and wholesale, they may not be small, but they're daily earners, right? And it means that what you kill is what you eat. The children are waiting at home. They need to go to school. They need to eat and whatever. So whatever they bring home that day is what they take to school to eat. And so imagine somebody going, when my mom was coming to the hospital, even when I was working, she would come to that hospital in the morning and she's not leaving any time earlier than 3. And she has a child. As a doctor, I would get her in, I would get her in quickly. And she would still get there in the afternoon. So imagine people who knew nobody. They would get there at like 5:30 a.m. They're picking numbers. Someone would get there at 5 a.m., 6 a.m. I remember I was talking to someone who was picking some number about something, I think one of our patients. And he was number 20 at 6 a.m.
Wow, already?
Yes. So you're picking the number, you go and get your card, they find your card, you queue, they find your card, then you go to the nurse, they check your blood pressure, then they arrange you with the doctor, and then you finish there, and then you go and queue for blood, and then you go and queue in the pharmacy. It's just like, it's just a cycle, right? And you look at the lives of these people, and every hour they spend away from their shop, they're losing money. But also when they fall sick, I tell them they're losing money twice. You're losing money you could have made on your sick day, but you're also losing money you have saved up. And so that's how we used to encourage them. So for me, it's that the second thing was, who's going to be that? Who's going to be, not so much their rescuer, but kind of like just try to align things better for them. And then the last thing that made me do not in a fancy places, I thought about it. We're building a technology-enabled company, and I looked at the landscape. What I knew and what I was aware of in the landscape is, are people really targeting the informal market? Are my peers, I'll call them my peers, really targeting informal markets, people who are not, who are not higher on the food chain? And if they were, how were they doing it? And I saw the difference in how I was thinking about it and how other people are going. I mean, they're great companies out there, working with pharmacies to provide consultation. It does what it does, but maybe the depth of education and the depth of medical training that I had made me think about it in a way. I'm like, I feel like that's superficial. And like I said, so maybe my innate instinct to just do the difficult thing, and then I now have all this education, and I'm like, yeah, no, I have to do it different. Like, so that just made me. So it's like you want to help market people. If you're trying to bridge the gap of transportation, geographic location, which is one of documented research barriers to healthcare, the travel time. Right? If you're trying to, then why not co-locate a clinic in the market?
Take it to them.
Right? So we put a clinic as close as possible in the market. So it becomes second nature. Like, there's sometimes they'll be like, I just want to quickly see somebody. They're like, okay, you can quickly come to IYEWO, right? And that's what happens.
I love that. And I love when you said you like to choose the hard problems and and you like to go about them the hard ways. But I feel like hard problems, great results, right? Yeah. And it's very evident in your story. Yeah. You mentioned your clinic employing technology. Why did you think the pivot to telemedicine was necessary?
One of the reasons is that globally, there aren't enough health workers. And in Nigeria especially, like, we're not producing enough. And then the ones that we produce, a lot of them are leaving the country. Yeah. You cannot have enough health workers, doctors, nurses, community health worker, any variety of health worker. We do not have enough. And so technology is a bridge to help us use the same human body to serve more people. That's one, just even per time. But also, how many places can one person travel to? So a doctor could sit in front of a computer and treat people at 2,000 kilometers away, right? And 3 hours away. So that helps to bridge that gap in just being able to reach more people.
I love that. And clearly, we absolutely need that because, like you said, a lot of doctors are moving away. A lot of healthcare workers in Nigeria are unfortunately moving away. Yep. So yes, we have technology-enabled medicine, and that's great. But it would be great to have these people come back.
Yes.
2 questions. First of all, would you advise, I'm sure you have friends that are medical doctors, that are Nigerian, that moved away. As a friend, honestly, would you advise them to come back? First question. And second question, what are some things that you would say in encouragement? Because at the end of the day, there's no place like home. And we have just one home. And the onus falls on us to do the best that we can, like you are, to make our home as great as we would like for it to be.
Yes.
So what would you say to your colleagues in the medical field, Nigerian doctors that are abroad right now? How would you encourage them to come back home?
So it's not one size fits all. I believe in self-fulfillment a lot. And so I'm not going to issue a blanket like, you should come back home. No, everybody has to stay true to themselves. Think about your life, where you're at, what you want to do, and who you really are. If returning back to Nigeria is a wish, a passion, a dream, something, a goal, then yes. Research, talk to people, build a community, those kind of things, so that you're not coming doughy-eyed where, you think everything is all glitter fat and you get here and no, it's hot air at the airport, right? Even though it's not hot anymore. Thank you to the minister, whatever they're doing. But for those who, for me, it's going to be a conversation with the person in, what do you want? Because there are people who are very passionate about Nigeria, but they will tell you, I absolutely cannot live in that country. And they can contribute. There's no one way to support. There's no one way to build, right? So they can support in so many ways.
Yeah.
I'm part of an organization now that is Doctors Foundation for Care. And it's mainly like, you know, a mixture, but predominantly diaspora trained doctors, Nigerian origin diaspora trained, and some local doctors or homegrown doctors rather, who are coming together and saying, how can we bridge? And one of the things that we're looking to do is, how do we serve as a bridge and a facilitator for those who want to come back or for those who want to contribute? So there are people who are abroad who could contribute by doing telemedicine, right? The only thing is, of course, the average Nigerian patient may not be able to afford a $200 consultation fee. So do you want to bring that down? Do we want to make it in Nigerian currency? Or do you want to do it for free? Or, you know, 2 hours every Saturday. Imagine a cardiologist just sitting in front of a computer and reviewing something for a clinic or for needy patients for 2 hours on a Saturday. I mean, I think that's something that's reasonable to give. So we can give in different ways. You could give your time, you could give your expertise, you could give your physical, actual hard labor, right? It could just even be mentoring medical students. And we can contribute in a lot of ways. So for advice is really just be true to yourself and get information, and then find a community of people who have lived it and can advise you and, you know, shatter the rose-tinted glasses quickly so you don't get in trouble.
I like that. I like that. Now, what is your vision for public health in Nigeria?
The ultimate vision is for us not to need public health in a way that we're aware of it.
Okay.
When, I remember when COVID was starting, and public health specialists, especially epidemiologists, were like, in an ideal case, what they would love is for everything to turn out, for everything to play out, and they are wrong. Because then it's great for everybody else. We don't have a lot of deaths, we don't have a lot of illnesses, but they're there because they've done the numbers, they've done the research, and it's like, yeah, we need to put the right things in place, just like vaccination and some other things where, yeah, we know it's going to be a shit show if you don't vaccinate people and kids are going to die and all of that. So my vision, I would say a realistic vision for public health is for it to be properly funded and properly equipped, properly resourced. Because resource is now not just equipment, but also human beings and the education, the knowledge gap, and all of that. And also for us to do things in a way that is acceptable by the people we're trying to reach. That's one big problem is we copy and paste things, we don't adapt, or we just bring things and somebody sits in a closed office and says, we are going to do this and we're going to do that. And the people you're going to talk to, do they see what you're saying? Do they see that goal? Or do they hear the language, the context, or the style with which you're speaking to them? So I think my vision for public health is just for it to be effective, well-funded, well-resourced, and effective so that we can prevent as much as possible.
Let's take it a step further.
Okay.
Now I want your vision for Nigeria in its entirety. If you were to, dream for a minute, what would you say your Nigerian dream is?
My Nigerian dream is a world where there's no impunity. Things work. Lives are secure. And Nigerians are happy to wake up as Nigerians in Nigeria or even outside Nigeria and to go build, to be willing to serve their neighbor and their community.
And so shall it be.
Amen.
It's honestly been such a pleasure speaking with you. It's been an eye-opening conversation for so many reasons. You're doing such incredible work. And I only just wish for you that you get more wind in your sails and you do so much more and create even more impact.
Amen.
Thank you.
Thank you so much for having me.
Thank you for coming. There you have it. A story of home, a story of sacrifice, a story of a daughter's love transformed into a brilliant and sustainable idea realized in the heart of Lagos Island. One woman's decision, rippling across the state, saving lives, literally. I wish I could say how much this story speaks to the spirit of sacrifice and the values we espouse on this program. Look inward. You have something to offer your family. Look inward. You have something to offer your community. Look inward. You have something to offer Nigeria. My brothers and sisters, look inward. You have something to offer the world. From right here at home, I'm Mimi Onolaja, and as always, this has been JAPADA. We'll see you next time.